I want to teach you my method of doing hand expressing. Now, this is one where every lactation consultant, every lactation nurse that you talk with is going to have a slightly different style of teaching it. So I'm going to show you my favorite method. And I also want to say that this is my hands down favorite skill and technique that I think that every breastfeeding person should know how to do, even their partners, and knowing how to help, because it is so beneficial for so many reasons. Now, in a previous video, I talked about how milk is made and where the glandular tissue is in the breast. So I'm going to review that just slightly. So inside the breast, all of the glandular tissue is made deep in the breast, not back all the way at the chest wall where the muscles are, but also not right at the nipple. That's not where all the tissue is. So you want to put your hand about mid-breast, about an inch or two beyond the edge of the areola. Now, you can put your hand like a C on your breast or like a U on your breast. You can use two hands at the same time. You can use a hand and fingers. It really doesn't matter. So what you're getting at is putting a wide hand on your breast and pushing straight in towards your ribs to get a big handful of all that milk-making tissue, and then a deep, firm squeeze. Now, I'm not talking about push in and then slide out. I see a lot of parents try to do this, but it's not as effective. So it's push straight in and then firm, deep squeeze back there. It's firmer than you want it to be, to the point of it's kind of uncomfortable, but not painful. As soon as it crosses over into pain, then that means that it's too much. So just straight back and squeeze. And after I do one, then I turn my hand just in a different angle, kind of like on a turn dial. So you're getting at a different pressure point, and then push in and squeeze. And you'll find that everyone has kind of a sweet spot where you'll tend to get the most milk out, and you don't know until you try. So once you find that right spot, then I change to more of a pulsing motion to help all that milk come out. Now, studies show that it is safe during pregnancy to start practicing this after you've made it to 37 weeks. Before that time means that you are preterm, and it could start contractions, which if you're at risk for early labor, then that is a risk for a preterm delivery. So I don't recommend this before 37 weeks. But after that time, when you're safe and close to full term, it is safe to start practicing this skill. After your baby is here, I like this because you can use your hands to squeeze out a milk drop. Maybe it's over here. You get to find the right spot for you. And once that milk drop is out, then your baby can smell it and taste it, and it guides them to get latched on better. Because you'll see that your baby will kind of go open wide mouth as they're searching around. So it helps them to have a focus to go forward and get latched on better. So it also starts your flow so that your milk is already flowing before your baby gets there. And then with colostrum, because colostrum is, if you watch the other video, it's a tiny amount, it's thick and it's sticky. So in doing that, your baby does have to build up these cheek muscles. But as they build up these cheek muscles, then later on, when you have a fuller supply and your milk is flowing faster, then they use that cheek strength to control that flow. So I'm talking about this both as helpful in the colostrum time when you have a small amount of milk, and later on when you have a more abundant supply. So use your hands to squeeze while your baby is sucking, because in this way you're pushing more milk to them. So they're getting a fuller belly with less effort, and you're getting better stimulation. So not only is your baby latched on and suckling down here, not on your nipple, but gums on the areola, then you are hand expressing at the same time. So that is the winning situation for the both of you. Later on, when you have a fuller milk supply and you have an older baby, you can still do this. You latch your baby on and squeeze while they're feeding. In fact, I teach this a lot of times when I'm doing an outpatient consult appointment to help a baby stay latched and encouraged. Now, do you have to do this every time? No, not necessarily, but I do find it most helpful in the first few days, or if you're having any flow troubles or keeping your baby on. I also do this skill when babies are really sleepy and they need encouragement to get those full feedings. I find that for newborns in the first few days, around 3 p.m. tends to be the sleepiest time of the day. So then you'll typically work harder to keep them interested and get more milk to them. Now, the reverse of that is about 3 a.m. when babies are wide awake at night, because babies have their days and their nights mixed up for about a month. Then you can do this to speed up the feeding. They get a good quality feeding and you get to go to sleep faster. I always think hand expression for the win for both of you. Now, this also helps for a fussy baby. If your baby does a few sucks and then pops off because it's like they're saying, hey, this isn't coming fast enough and I want some more, then keep your hand on there and help your baby to get more milk a little bit faster so they get a fuller tummy and then they're happier. So hand expression for the win.